everyone. Welcome to Caapid Simplified Student Series. I'm your coach, Dr. Leena, and today's video is the only school we all have our hopes left with. You can guess what it is? By this time, I know you are either preparing your application for next Caapid cycle or waiting on the one and only school, that's Colorado School of Dental Medicine. And I thought, let's gain some insights about CU as they have recently sent their first batch of invites. So let's welcome the expert for all the advices you might need and our kind guest, Dr. Vandana, and learn from her learnings. So let's get set, go. Hi, Vandana. How are you?
Hi, Leena. I'm good. How are you? Thank you for the beautiful introduction, by the way.
Definitely. I want to thank you rather to come here and record this video with us because
no, not at all.
No, at this time, all the invitees, they need expert guidance on how CU works and how the app, what extra effort they can take to get the acceptance. So it would be great video for all of them.
Great. It's my pleasure to help. And I'm not sure if I'm an expert, but I'll try my best to, give out whatever information that I've seen and I've experienced. Happy to help.
Definitely. So you are already 3 months into the program. Let me ask you this way. How exhausted do you feel?
Oh, exhausted and ISP first semester, they go hand in hand. Like you're always tired, you're always exhausted, you're always stressed about so many things, especially it's like a accelerated boot camp, you can say, because they're trying to fit everything. They want to get all your theory correct. You want to get all your preclinicals correct before they actually give us a patient, because we start seeing patients in May and they want you to be there. Like, they want you to do everything beforehand. So basically what I understand after I got into the program is whatever the DS 1 and 2 have covered in the 2 years, they try to cram it into the first semester for us. So you can only imagine how hard it will be, especially going back to basics like dental anatomy, preclinicals. We haven't worked on that perfect axiopulpal line angle and everything. So it's so, and they're always it's nice in a way because the school has quizzes before every class. That way it's not overwhelming when the midterms or finals come in. And honestly, that's the only way I read. I go back to my lectures and read before the quizzes. That actually does really help. All the subjects like, perio-beat, perio-lab beat, prosto, the removable lab, they make you do it on yourself. Like if there's a Facebook relation or anything, I do it on my partner. So they teach you, the lecture would be the previous day or the same day. And then the same day you go to the lab and do it. And it kind of, you correlate between what you're learning versus what you're doing, and you'll be like, oh, is this why you do it? And I'm like, okay.
Wow.
So it kind of really helps, and that makes you remember things more easily because you literally do it the same day and not wait for like one CD patient that you get and try to go back to the lectures and brush up what you have to do. So it kind of helps that way. But yeah, it is a lot of information to process, lot of information to go through. But I guess we'll survive. Everyone survived. We'll survive too. That's our motto right now.
Yes, but I'm amazed that the education system varies from all other countries than US so much. It's so practical oriented, and even being an ISP, schools try to integrate us as if we are going into the long-term program, 4 months. So
correct.
It's definitely hectic for us, but it's for our good.
Yeah, I agree. And especially I've graduated in 2015. So like in India, at least in my college that I went to, the prosthodontics, I did a couple cases, but if you ask me any question right now, I have no clue of what I did, So it does really help you, and also because you'll have to practice here later, it helps you with that standard that the ADA expects from you, I guess. So it really helps you with all of that. And you're right, they teach you from scratch. They want you to learn everything, and they're so patient with, even if you ask the dumbest of the questions, they'll be more than happy to help you. It's very nice. And like you said, that it is really different of how we are taught in India versus here. It's all clinically applied. Even the materials and everything that you discuss, it's very like all the applications are discussed clinically and how you actually practically use it. So you're right in that point.
I'm sure all our viewers are already motivated to apply Caapid now, because there is so much to learn, right? There is so much the school is going to give you, and it's all worth it.
That's true. That's true.
So let's start with knowing you better, Vandana. Give us a little about your background. Where do you come from? Why did you choose US, and what do you aspire further?
Okay, so like you already know by now, I am Vandana the Girala, and I'm from Hyderabad in India. I got married and I moved to the US the next year. And after I got here, I shadowed at multiple places while I was preparing for my boards. And that experience kind of helped me because I got to see how multiple practices worked here, and then I also did my license exam for assistantship. So I got my CDA. And then I started working. And I initially worked as an assistant and also did the front desk because it was like a brand new office that I started working at. It was like, when I look back now, I'm really thankful for that opportunity that I got to work as well, because now if I set up a clinic, like say in a couple of years now, I know what the admin work is. I know what insurance is, because when I got here, I knew nothing about it. I don't know what insurance is. I don't know what claims are. So it kind of helped. And then I worked for about 3 years. And the last June was when I got invited for Colorado. And yeah, I moved. I was living in Pittsburgh earlier, and now I moved to Colorado. It's been a couple months, like I'd say I moved in December just before orientation.
Both are beautiful cities, Pittsburgh and Denver.
Yeah.
So tell us more about your US experience. Like, why do you recommend our candidates having more of US experience, shadowing and volunteering, what you did, and even your DA experience?
When I got here, it was all alien to me. I knew nobody. Nobody in my family is a dentist. None of my friends who moved along here wanted to pursue, or they were doing some other masters, but not into dentistry. So it was like I had to pursue, like I had to knock every door, ask for opportunities, or email them. It was time taking. I literally had like a list of all the were near my house that I could just go by myself without being dependent. So I do, sometimes I don't, sometimes they're busy, but whatever it is, I kept following back with them. And I didn't look at, no, this is not what I want to do, or this is not the specialty I want to explore. I looked at every office, be it general dentistry, be it health, like a government healthcare clinic, or an endodontist, or a surgeon, or a prosthodontist. It didn't matter. I just wanted to learn how things were here. And at every clinic, I kid you not, there's something that I have noticed or something that I have learned. I'm like, oh, I should do this. Oh, this is nice. Like that, like, you can say advancements that are there in the practices, or you can say the way they treat the patients, or the way they've set up the office. There's some take back that I had from each of shadowing experiences. There not, if you call like 30 offices, there might be only 5 offices that actually get back to you, but that's okay. That's okay. Just take advantage of which clinics or which doctor gives you the opportunity. Go ask them their experiences, ask them what they've learned. and you learn something or the other. I've also shadowed in there are places where I've shadowed for 8 months. There are places that I shadowed only for 2 hours. So you can see, how open things are or how restricted things are. So it's okay. You just learn something. What happened? What would happen? You just go there, make some new contacts, say hi. If you like it, you can go back. Or if they agree, you can go back. And then otherwise you don't. That's it.
Wow.
That is my take. That's that's what I did. I just try everything. What could go wrong? What would they do? They won't eat you up, right? So that's about my shadowing experience. Even while I was working, my employer was very he is an international dentist himself. So but he graduated like a decade ago almost. So he didn't know what CAAPID was. He didn't know what I was doing, like, because I was volunteering, I was shadowing, I was working. He's like, what are you doing? Why are you doing so many things? And I'm like, this is how it is. This is the new normal. You won't know. But he was really supportive. Like, whenever I had to shadow, whenever I had to, I had a place to volunteer to. Like, if I give him prior notice, he would kind of accommodate accordingly. So I would, even for volunteering opportunities, there are hundreds and thousands of opportunities that, you can look out for. But what interests you is what matters, even if you like volunteer at a place that doesn't make sense to you, or it's of no use. So yeah, I looked out for volunteering, like Mission of Mercy is one nice dental event that you could attend to. Yeah. And then Team Smile is another periodontic program. So just look around. Go. That's about my volunteering and shadowing experiences.
That's very, very inspiring, Vandana. I want to ask you this thing. So I could sense that you are very open and, very versatile when it comes to gaining opportunities. So what do you think makes you that open to all the opportunities? Like, how do you manage stress? Sometimes you feel so overwhelmed. Okay, cycle is coming, I have to apply. How did you manage that?
Oh yeah. Stress. The waiting time it eats you up mentally and emotionally. There have been so many times you self-doubt yourself, like, am I doing this right? Especially when you get a lot, you get rejected with other schools, or like you said, it is very overwhelming with all the material that you have to pick up and get ready before the cycle happens. What I did was I maintained like a sheet. Like I had, so I applied to all the schools I could.
Wow.
Okay. So because you never know what could happen, or you never know if opportunity comes from which way. So I just had a file of ask you for separate reports, like, TOEFL or EC or whatever. So everything I would write down. There are some schools that ask you specifically for a separate pattern of CV. So I would write that down. Like any special requirements that they ask for. There's one school, I think, that asks for volunteering certificate or something like that.
Yeah.
So,
Indiana.
and number of C. Yeah, I think Indiana. Yeah.
So
So I would just
demystified the whole process and got your research done, right?
Kind of, because that is the only way that would keep me sane, according to me. Is like a trial. You just touch the waters and see, what school requires what, and that's just like, it's a trial period. There are people who get lucky, and get invited. I wasn't one of them. But it was like a trial. I learned, like, from the second cycle. By January or February, I had all my materials ready, all my supplemental applications ready, especially recommendation letters from India.
Like, there is no first, second, third cycle. The cycle you get in is your first cycle, because that's when you know what the process is. Otherwise, everything is, just a puzzle. You are trying to solve it. So,
oh yeah. Even after you get the invite, I would say it's a puzzle, because that's another journey that you'll start.
Yeah.
So I'm sure you would have experienced
Even
the
I
same.
used to get all the
Of course, everybody's a human. Everybody gets low, especially when you see a rejection and you're not used to being rejected. So you will get low, you will break down, and that's okay. It's okay to break down. Just pull up yourself next day, and that is what counts. That is important, to bring everything together the next day, and go from there. That'll exactly move you in the right direction.
That's a great advice, Vandana. So how you get up, putting all the things together and gather all the motivation and go again,
Mm-hmm.
walk this path and try to figure out everything. That's an amazing advice.
Yeah.
So let's touch up a little bit about your interview as well. So as soon as you got your invite, how did
Mm-hmm.
you strategize your next moves?
As soon as I got my invite, so I interviewed at Colorado twice. Okay, so the first time was in 2020. So for the 2019 cycle. So that was very new to me. And when initially they were in a dilemma because COVID just happened in that year, and even the school wasn't sure if it was going to be in person or virtual, and the school had to figure out themselves how they would organize if it was virtual, etc. So there was a lot of confusion, and there wasn't a lot of information that was given out to us in that cycle. So interview was so what they decided, usually for Colorado it would be if it was an in-person interview, there would be interview and bench test for everybody that's attending.
Mm-hmm.
But for virtual, what they've decided was from the pool of interviewees that they get, they would select a few people and only those would sit for bench. So in 20, like for my first interview, my goal was to clear the interview. That was my goal, because otherwise, there's no point getting until there, right? So it was my first interview, to be honest, at that point. And I think everybody does this. You just Google all the interview questions that they could ask, and just rehearse. That's what I did. I would just open Zoom, record myself, and then go back to the recording and see how I was doing, and if I was boring people, like if I were the audience or I were the interviewer, would I be bored with my answers? Because it's a hectic day for them too. It's a weekend for them, and they're taking out the time. I don't want to bother them with all nonsense or boring stories. So there are so many questions that you could prepare. Especially Colorado asks a few ethical questions and clinical related. Basically, my first cycle was based on my experiences because it was my first cycle, right? So they wanted to know me more as a person. So all of the questions that were directed to me were either based on my personal experiences or how I am as a person. Like, what I learned from this experience, or what I would do if, if I'm in this cycle or something like that. In the second cycle now, because they've known enough about me, all the questions were clinical or hypothetical, or behavioral kind of questions. So it was like, in a clinical setting, if this happened, what would you do? So it was like that. So being prepared is good, but just don't expect that they would ask you the same kind of questions.
Yeah.
Like, if you prepare for what are your strengths and what are your weaknesses, they won't ask you directly, like, what are your strengths? Let me know. They would be like, how would Colorado help you, be the person you want to be, or something like that. So in another way, that's how they frame the question.
Yeah.
But you just have to be calm and confident in what you're on, and just be true. I know everybody says this, and even every what do I say? Everybody who's in the school, they'll be like, be true to yourself, and I can't agree with them more. And it is a 100% true. Just be yourself is very, very important, because once you that 30 minutes is the only window that you have to impress them. And if they like you as a person, the chances that in the school they increase a lot.
Yeah.
They're so high at that point because they want to know you more. They've seen you on the paper, which is why you're been invited, right? So they just want you to be yourself, and they just want to see if you are able to learn new things, if you would be just go along with all the other classmates and everything.
How adaptive you are.
So in the first cycle, bench was for 10 minutes. Like by the time you realized you were giving a test, it was over.
Yeah.
It was really short.
As far as I remember, it was all about criterias, right? Like the dimensions, and which you already know if you're practicing bench test, which most of are already doing because they didn't know how COVID will change the conduction of the bench, right? But the second cycle was very intense. I remember I had candidates through a webinar, and I was happy that 20 out of 40 participants got in, but I taught them
congratulations.
Oh yeah, thanks. So they asked about perception ability, about treatment planning, about case diagnosis, prognosis, right?
Yes. Actually, even in our interview, there would be a periapical radiograph. They would ask you to interpret, and it depends. Sometimes they would rotate it, sometimes they might not.
Is that, you are so open, and you are bringing both of your cycles experience. So it's basically 2 years that CU has started conducting virtual, and whosoever is watching this video, they know what is their expectations now, and they can prepare accordingly.
I hope it helps them. And effort that they took to have everybody, and it's amazing. Especially they'll have like one faculty to or just one, like there'll be 3 people on the panel for your bench too, and at least I had 3 of them. I don't know about others. One was timing you, one was writing down whatever you're saying, the other one was navigating through the software or PPT or whatever it was. So they put in a lot of effort and thought into what they were doing.
You know what's Vandana, about how many candidates are called in the interviews, and then how many are selected in the virtual bench?
Yeah, I think they usually there are like 3 batches of interviews that they conduct, I think in March, April, and May, and the bench is usually in June. So for each batch of interviews that they conduct, I think there are around 80 candidates. So that's about 240. And they invite at least half of them for the bench.
Around 120.
So your chances of getting in the ratio goes from 1:6 to 1:3.
And do they invite all of them for bench all together, or as soon as you are done with interview, within a week, you will get a notification for bench?
Within a week, you'll know if you're being invited to the bench, but all the candidates sit for the bench exam on the same day. So it doesn't matter if you're interviewing in March, doesn't matter if you're interviewing in June or May, your bench would be the same day.
Yeah. Okay. So now that brings me to a great question. Why CU? What are those special aspects of CU that attracted you? And especially you were waitlisted for the first, and then you attempted to apply again, and then you are there. So what was that special about the school?
One is one of the doctors that I've worked with as an assistant. He was an alumni from CU itself. So he was like, and he graduated in India as well. So he's seen both the studies, or how things are taught in each different countries. So he always like, in CU, this would happen. In CU, they would do things this way. In CU, you would have done this, So it kind of gave me an insight of how things would be in the school and how you would learn. And he was like, at the point, while prescribing, for example, I would be like, how do you remember so many drugs and with all the trade names and everything, especially because the names from India versus here are very different, most of them.
Yeah.
Right. So how do you correlate? And he was like, you learn in school. You learn everything in school. Those 2 years will be the best years that you learn. And, so that was one thing. We like, oh, because it's amazing. It's so beautiful. Like I told you before, we've been here for one of our anniversaries. I was like, oh God, I would die to live in a place like this. It's so beautiful. And there's so many things that you can do around. You just drive by, even if it's a freeway, if it's on a freeway or a local route, it doesn't matter. Every frame that you see from your window is so picturesque. Like, it's so beautiful with the mountains. It doesn't matter if there's sunlight or snow. It's very beautiful. And there are so many things that you could do. You could hike, you could just take a walk, you could just sit around a water body, and it's still beautiful and you still get that peace. So that's one of the major things that attracted me for CU. And then, like I said, the way they organize the bench, and because especially I've seen the improvement from the first virtual bench to the second virtual bench, I was blown. My mind was blown at how much effort they actually put in to make it, to just select the best of the best. And the way they communicate is also amazing. Like, Marcy was our student manager or coordinator at that time. So she's not working at CU anymore. But yeah, so the amount of communication that, or every email is addressed to you. It is not, even though it's generic, even though it's an announcement, it is addressed to you. You will have your name on the email, and it makes you feel special. It's not like dear everyone, or if somebody says dear Dr. Leena or dear Dr. Vandana, it makes it personal in that way, even though it's a generic announcement. So the communications were great. And the faculty that were interviewing also, they kind of make you feel very comfortable. It's like, you're talking like, just like how this is going on, it's casual. The stress and everything is within you. They kind of make it as comfortable as they can. They're very warm and welcoming. Even the alumni, or even the current students, they actually graduated last December. But the current students at that time that I spoke to were like, they were very nice. And it was almost like, even though I hadn't known them at all, just approaching them via Facebook or Instagram or my friend's friend, even if it's that way, they were very approachable. They gave me all the information that I needed, and it actually helped. Especially, like I said, I do not have anybody who's been a dentist here. So that really helped. And I'm like, if this is somebody that I do not know is doing for me, I can only imagine if I'm in the school, and the amount of support that I can get, and the amount of things I can learn from my classmates. As a matter of fact, from our class strength is, or the class size is 40. And, there are so many things that you learn in the process. So...
And CU's class is diverse as well, right? You have fresh grads, then mediocre experience, then people with research, and everyone.
Yeah, it's very diverse. Like, 40 members is a lot. It's a lot of brains coming through. If I'm not wrong, 11 to 16 countries from our class.
That's multicultural then.
It's from Mexico. There are so many people that from Europe, from Iraq, from South Africa. I think there are so many countries. So the diversity is great.
That's so good to hear. And I wish all the viewers are listening this very carefully, and now they are motivated to give their best in their interviews and bench at CU. If there is one last advice that you would like to give to our viewers, Vandana, who are even applying for the next cycle, what would that be?
Try not to stress. And, it's okay. It's okay to fall down. It's okay. It's okay that, things don't work out in the way you've planned. It's okay. Then that's how it should be. And that's how you learn. In retrospection, that is what I think. When I started my work as an assistant, I was like, why am I doing this? I didn't enjoy it, to be honest. But looking back now, it actually gave me an experience, of how things work inside an office. And I wouldn't have traded it for anything else. If I got an admit, in the first cycle that I applied, I wouldn't know the amount of hard work. I won't value it as much as I do right now. And also the experience that I've gained, I'm proud of it. There's no doubt that there would be rejections. You would fall down, and that's okay. Just say it's okay. Things happen, and it's okay. You will be okay. You will be there, and that will get you along. That's what I did. And planning is very important. Having things beforehand is very important, especially I don't know if the campus cycle is open. Did it open already?
Yeah,
okay. Yeah. So yeah, try to apply as soon as you can. Don't overwhelm that things didn't happen. It's okay. If something happens, just contact the school. They'll also help you in whatever way they can.
It's fabulous, Vandana. It was so refreshing talking to you on Sunday. Thank you so much for taking time for all of us.
Thank you. No worries at all. It was my pleasure. Thank you for working around my schedule and rescheduling multiple times. Thank you so much.
Definitely, guys. If you have any questions about CU, we would be happy to help. As you know, we all have demystified the whole process for you. And I would suggest you to save your time and accelerate your journey with us. Signing off, Dr. Leena, your friend and coach, Caapid Simplified. Bye-bye.